Hi, my name is Heidi Carley, and the title of my project is Decreasing Delirium in the Intensive Care Unit, Re-Education on Delirium Prevention Interventions, a Quality Improvement Project. The team was myself, Dr. Lindsay Davis, Ann Alvarado, Rayanne Fondrest, Emily Bird, and Patricia O'Malley. So there's some background information on what delirium is, the risk factors, certain interventions, screening tools, etc. The purpose of this project was to determine if re-educating bedside nurses on those specific things in the background information, if it would increase the critical care nurses' compliance with delirium prevention interventions, specifically sleep promotion, charting, and decrease delirium rates in the ICU. So the target population were ICU patients aged 18 years and over. We left out COVID patients and patients that went from ICU to the behavioral health unit. In the pre-education group, there's 39 patients. In the post-education group, there's 36 patients. We used multiple audit tools to look at the compliance of the promoting sleep. So having lights on and blinds up in the patient's rooms during the day, having lights off and blinds down at night, and then different audit tools to look at charting compliance of the nurses and chart reviews of the patients, pre and post education. All data was stored in REDCap and then exported to Excel for data analysis. And we found that there was an improvement in the charting of the RAS scores, but not the CAM scores by the nurses, and that there was an improvement in compliance of the environmental factors, having lights on and blinds up during the day, lights off and blinds down during the night by the bedside nursing staff after the education. So there's also a decrease in the patients that had to come back to ICU once they left or transferred out, and the decrease in the number of patients that expired during that admission after education. There was not a decrease in the number of patients overall that had, not a decrease in the rate of delirium after education, but there was a different patient population, different diagnosis pre and post group, so that's a limitation. Staffing was a limitation for this project. There was a new nurse role implemented during the post-education period, which we thought was a limitation. We thought adding more patients to the study, so having a bigger ICU or extended period of time to do the pre and post-education data collection would help with maybe showing some decrease in delirium rates. So our conclusions were to implement a longer auditing period to gather more data, inclusion criteria to be more specific as far as diagnosis, such as having a respiratory admitting diagnosis, investigate what can be done to further improve charting compliance with the bedside nurses, and then for the future, explore interventions of the ABCDEF bundle and the effect of the bundle interventions on delirium, because we just looked at sleep promotion. So we could look at early mobilization, decrease in ventilator hours, decrease in sedation, and things like that in the future. Thank you for watching.